And Dr. Gordon is probably the most in-demand pediatrician in Southern California. He has been associated with really many high-profile cases that have been in the news, and he's got very strong and unique and sensible views on the not just immunizations, but the medical establishment and the health and pharmaceutical industries. And so we're going to speak to Jay first and then take you to talk to Jake and meet Jake. And really my interest in doing this episode was as a new parent, and suddenly you're faced with decisions in which you have the life of a child that you're responsible for. And whether you're a parent or not, two things to listen for specifically in this are, one is about becoming your own advocate for your own health, something that Gabby and I feel really strongly about, and not just accepting the authority of someone with a title. And the second thing, well, we'll let Jake tell you that second thing himself, but I've thought about it every day since. Enjoy. So this is a very unique episode of the Truth Barrel. The first thing being we're actually not in the Truth Barrel.
Yes, I have my clothes on, and you do too.
I do too.
Yes.
Yes.
And it's a regular room temperature, but we're here for a really important reason, because I've been just kind of going through a challenge as a new father, and I never really realized this till I became a father, but you're really responsible for all the medical decisions of a vulnerable child, for the entire life of a vulnerable child. And my problems began day one in the hospital. And they began day one, and I'll tell you what happened quickly, and I'll tell you where we are, which is that when my son was born, they said his temperature's too high, and we have to take him into NICU, to the neonatal intensive care unit.
Yeah.
And I had a pediatrician at the time, and I called her and said, "Is this for real? What's going on?" She's like, "Yes, because his temperature is that. It could be this. What's the infection they might have? Something itis or."
Oh, meningitis.
Meningitis could be meningitis.
After birth, if there's a temp elevation, they dial everything all the way up. They assume
nuts.
the worst.
It was nuts. And we're here with Jay Gordon. Sorry about that. We're here with Dr.
We forgot my intro.
Yeah.
Not at all. So so let's back up for a second. So you and I talk about parenting and our children all the time. So I have been fortunate enough to use Dr. Jay Gordon as my pediatrician who looks after my girls, as so many of my friends. So he was kind enough to let us come to his office in Santa Monica.
Right. And Jay Gordon, I'd say, is probably one of the most well-known, highly recommended pediatricians in probably Southern California. Everybody I mentions Dr. Gordon's name.
That's right.
And yet you didn't invite me into your hot tub.
Well, we were trying. We know you're a busy guy. You got twins. In fact, you will hear Dr. Gordon's phone ringing throughout this because he's on call today.
I set it to vibrate.
Yeah.
But it's okay.
And he's on
These
call,
things
so
are
if
important.
it's interrupted, it happens. Take the call.
That's
Gavin and
fine.
I will talk
That's
amongst
right.
ourselves. So this was a horrifying experience, because what happens was, first of all, I'm the most worried new father. I didn't want to make a mistake. But at the same time, I knew it'd been a long labor. My wife was hot. I knew he had this temperature. So they put him in there. Right away, they give him like a spinal tap. This kid's just born, and they're giving him a spinal tap. It's a painful thing. You're getting heated up right there. Then they give him a Hep B shot, because they starts the immunizations, and then they give him like a antibiotic drip, and it was like it has changed everything. I just used to trust hospitals and how it worked.
Well, they didn't give you any context.
Right.
It's like someone who walks up to you and points at a dot on their skin and says, "Could this be cancer?" The answer, it could be cancer, but it also could be a little magic marker that you forgot to wash off.
Right.
They didn't tell you that babies get temperature elevations, and how often is it something serious? Not. But you don't want to fall a day behind a dangerous infection in a baby, so again, they dial it all the way up,
Right.
and then they dial it down. But they should let you know that, firstly, it's so rarely anything dangerous, and secondly, we've got you covered. And we've got your baby right here in the newborn intensive care, in the NICU. And it's pretty unusual for anything to go really wrong.
Yeah, and so he didn't get a kind of bond, and then regular way he was with his mom, and he's getting poked and prodded.
It wasn't fair.
Yeah, and
I won't ask you which hospital you were in. It was a local hospital?
It was a local hospital very close to here.
Does it rhyme with Cedars?
It was UCLA. I don't care that they did that, and they're just following their protocol. They're not
right.
That's their protocol. If there's a certain number here, you go through a certain protocol.
And by the way, they saved some babies. I mean, if the baby had, and
Right.
I don't remember, if the baby had meningitis, they would have saved the baby's life.
Right.
But they also just should have given you some context, explaining to you that we treat at least 30 or 40 or 50 babies for everyone who really does have an infection. But you can't play those numbers. You can't fall a day behind.
And what I learned, was one thing, is you almost have to become your own, you have to do your own research and really know what's going on before you walk into these scenarios, I would think. I'll give you the second story, and then I really want to talk about the main subject we're here to talk about, but and also lead into the bigger part of why we're doing this podcast. But so I learned my lesson. So later, oh man, this kid's had a tough life. So the worst thing that could ever happen to a boy. What's the worst thing that could happen?
Right. Oh,
Is it
that's
so?
right.
So I go to get him circumcised. I don't know how you feel about circumcision. I'm curious for your thoughts on that.
Avoid it if you can.
Right.
I mean, it's unnecessary surgery. It really doesn't prevent. It doesn't prevent anything.
Yeah.
Well, because the numbers are, it's like, oh, it gets dirty, it gets, right? Like, what's the thinking originally?
Yeah, and when they tell you that there are many times, that there are 10 times more urinary tract infections in boys who are not circumcised, they forget to tell you that the number of urinary tract infections is incredibly small anyway, so it's 10 times an incredibly small number. Context,
yeah,
again.
and this all leads into the bigger point. And so take him home, unwrap his diaper, covered with blood, just bleeding all over the place. It was the worst experience. We take him to that pediatrician who I'm now no longer with, who's just mutilating his stuff, trying, he's crying, screaming. I'm like, oh man, I'm a deep believer in these experiences affect your psychology. So we take him to the hospital, and they say, I'll tell you what, we're gonna have to stitch it up. We'll have 4 shots, 3 stitches. I'm like, so that's the moment when I asked, but are there any other alternatives? Can you just hold pressure? They're like, yeah, we could hold pressure, but it'll take an hour maybe, and we don't know if it'll work. I'm like,
We got an hour.
we got an hour. Just
We've got
try
an
just
hour.
holding it before shooting them up with needles and stitching them up for life, and that actually worked. And that was the moment I realized that this system that we have is based on different criteria than actually making us healthy. It seemed they're based.
That's correct.
Yeah. And so,
correct.
what are your overall thoughts on this system and its problems?
One of my overall thoughts
Yeah.
is there's no money in good health.
Right.
I mean, that's being overly cynical, by the way. But you're
But these
right.
places are businesses.
You have to be your own advocate. If you've got a child, you've got to be that child's advocate. And your doctor may not give you the kind of personalized care that you want.
And it's more about avoiding maybe a mistake than actually doing what's right.
And that's not bad. I mean, I'm okay with cautious medicine.
Right.
It's just that when people say we're going to err on the side of caution by giving you antibiotics, they forget to tell you what the side effects of the antibiotics might be. Now, they might not be dreadful, but there's nothing free. There's nothing free about that hepatitis B vaccine.
Right.
It costs the immune system something. It costs the baby something. I very often have had to advocate for the baby and the parents at a hospital where the baby had a temperature elevation. Okay, a newborn with a temp elevation of 100.7 can be watched. You can sit there with that baby and watch the temperature come down. Now, you don't want to leave the baby alone in the nursery for the next 6 hours and take his temperature again. You need to watch very closely.
Right.
It is very cautious to do a blood test and have a good look at the white blood count, but every single 100.7 or 101 degree newborn does not need to go to the NICU.
Right.
Because there's nothing free, again, about all of the tests, the antibiotics, the interruption of bonding, the disruption of normal flora in the intestinal tract with those antibiotics. Those are medically expensive issues, not to mention the real cost, the dollar cost. But medically, that's an expensive intervention.
Yeah.
And I want to say, just from my point of view, having dealt with Dr. Gordon, who came, I think, at 2 a.m. to my room when I had Reese, and he was standing in the door, and he's like, I hear we have a new baby. And it was like, looked at her, checked her, her hips, and checked her out, and said, okay, you're going to nurse her, you're going to, when she was older, you're going to give her a great diet, and, it's everything's going to be great. But I will say I've had friends that have different scenarios that the child needs a specific kind of care that could involve medicine and that Dr. Gordon has said, yes, we've looked at all the options, and this is the correct option. So the other side of that isn't, no, not ever. It's for each child in each situation.
And then what we're talking about doesn't just apply to children and parents. It's any situation where you're in the hospital system, whether you're...
Well, the problem too with the hospital, especially I can tell you after giving birth, when we had a fire here, so I was flying back to have to have Brody here, and the fires, I stayed in Hawaii, right? So I'm in the hospital in Hawaii. They come up to me, and the pediatrician comes up to me that I don't know and says, hey, you want to give him Hep C shot and this and that, and let me give you can I give you my argument? Now I'm tired. Luckily, it's not my first child. But I said, sure, but you're just going to have to convince my husband.
Right, Hep B, you mean? Is that what you said?
Yeah, Hep B. He said, because you don't know who's going to be holding your kid, this and that. I go, actually, I do know. But I remember thinking, you're tired, you're vulnerable. If it was your first child, you want to do the right thing. You feel guilty. You have all this stuff going on. And so you're really vulnerable in that moment. So it's hard to push back or be an advocate for yourself or your child, especially in those kinds of moments.
Right, and Hep B is through a blood transfusion, right? It's like,
You
what are the
get
chances?
sex and drugs.
Right, so
Sex and drugs.
so probably
Those are the two ways you get
he's
Hep
probably
B.
got, I mean, my son, he's probably got at least 5 till that's going to happen.
right.
So he's got a few
Yeah,
years.
I mean,
It'll be a while.
Yeah.
But again, hepatitis B is a public health measure which has worked, but I take care of one kid at a time. Public health's really important. I mean, I don't want to see vaccines done away with, and I don't want to see all babies. I think that everything has to be individualized, but there is no chance whatsoever that a healthy baby in a healthy family is going to contract hepatitis B. It's transmitted vertically from a mother who doesn't know that she has it, which doesn't happen much.
Right, and you can
And
test the mom rather than
You
giving the
test,
child
moms
a
are all
vaccine.
tested. Every single
Well,
mom's
and we're
tested.
tested out, you can't
You're
believe
tested
the
and
test.
tested, and
And I
yes.
had to get a shot because Laird and I have a positive and negative opposite blood type. So for the next pregnancy, you get a test. I mean, they test you for everything.
I can tell you that I used to say, I would speak more strongly about public health when I was speaking publicly, and less when I was speaking behind closed doors. And now I don't think that's ethically correct. I mean, I tell people you can't ignore public health. If we don't vaccinate your child, the impact on herd immunity is pretty much close to zero. Okay? But if I tell that to everybody and you tell that to your friends, we will decrease herd immunity. So factor that into your decision.
Right.
But you are very much entitled to be selfish about your own kid.
So let me tell you something, Dr. Gordon. This is funny. I didn't think about this before, but it's true. So I live in Malibu, and everyone's Malibu-y, which means most of my friends, ACU, they don't have immunizations. I told my wife, I'm more likely to give, if we were living in, Bismarck or something, I probably wouldn't give him immunizations, but because we're in Malibu and almost no one has them, I'm more likely to get these shots for him.
And I'll tell you that I think about that because I take care. I mean, Waldorf schools are famous for having a real alternative point of view, and the highest percentage of non-vaccinated kids is found in Waldorf and similar schools. And I keep waiting for a whooping cough outbreak, and it hasn't happened. And the reason is these diseases, even the most common of these diseases, which is whooping cough, it's still a rare disease. It's something I don't want back. I don't want to stop vaccinating. But you may be aware that we are now aware that our whooping cough vaccine is too wimpy, that it has a 75% take rate and it lasts for 2 to 4 years. We had the old DPT, the whole cell vaccine, which was really a gross vaccine. We sort of just chopped up the bacteria and injected it, and the immunity was fantastically good. Unfortunately, there were side effects of seizures, brain damage, and death, so we lost that vaccine. And now we have an acellular vaccine, which has gone from, I believe, 3,000 antigens, 3,000 components, down to 3 or 4, and it doesn't create really good immunity, and everybody knows it. I mean, there was a good New York Times article a few years ago that quoted somebody, I believe, from the California Department of Public Health or the CDC, saying that yes, parents who don't vaccinate are taking risks, but that's not the driving force behind these outbreaks. The driving force is the fact that we don't have a good enough pertussis vaccine. And that is getting very little play in the press these days. They're pointing fingers instead at vaccine hesitant parents. Our vaccine, we've got a few vaccines that aren't good enough. We give the measles, mumps, rubella vaccine, the triple live virus vaccine, and then to check on immunity, whether it's going into high school or going into college, where they want the second and maybe even a third MMR, I draw blood. And I can tell you that 50% of the time I'm seeing failure of the mumps immunity. And the reason is, simplistically speaking, which is all I can really do because I'm not an immunologist, the immune system creates antibodies better against measles and German measles and rubella, than it does against mumps. Those three compete for the attention of the immune system, and the mumps component fails. And we're doing it wrong. We should be giving them separate.
So I know I've asked this 10 times. I'm going to ask it one other time because I just don't get it. I just don't get why this is controversial to say to go do a different schedule, separate these three into one. You're still getting immunized. So why is it?
You're not saying don't get vaccinated. You're saying let's slow it down. Let's consider the individual, and let's give the child a chance to develop their immune system. And
yeah. So what is the deal?
Because by not giving the vaccines as early in life as possible, you're leaving the child susceptible to these illnesses for a period of time. I'm supposed to give 6 vaccines at 2 months of age. DPT, polio, hepatitis B, pneumococcus, Hib, and rotavirus, the anti-diarrhea vaccine. 6. Now, if I wait till 4 months of age, during that 2-month interval, your child has a greater chance of getting whooping cough. Now, what if I told you that the child's chance of getting whooping cough was 1 in 5,000?
But also, where are these babies at 8 weeks old? Where are they hanging out? Are they at the saloon?
They're
at home. They're with their parents.
No saloon, no play groups.
They're 8 weeks old.
But there is validity to that. There is validity to it. And my argument to counter it is, I really think that by giving all 6 vaccines that early in life, all at once, you're creating a risk greater than. But because there's no proof, and it's just so easy to attack and repeatedly attack that point of view. Can you?
But why would you need to give an 8? And this is a genuine question. An 8-week-old child a vaccination for anti-diarrhea. What's going to happen to you?
That vaccine could save lives in the third world, and in America they say that it could save a couple dozen lives a year, and I think their data are shaky.
What do you die from? Dehydration? I don't know.
Dehydration. It's not a very. If you lose a child to dehydration in America in the 21st century, I don't think you're doing a great job.
You left him out on the patio for a couple days?
I mean, again, there are high-profile cases of people who've decided, whose child, I don't remember whether it was Canada, it might have been Canada, whose child had meningitis, and they decided to wave a feather over his head instead of taking him to the hospital or something like that, and he died, and they said, well, he hadn't had any vaccines. Firstly, there may not have been a vaccine against the type of meningitis he had, and secondly, if your child's sick, don't wave a feather over his head. Get him medical care.
And this is important because this is what I do so respect and appreciate about you, which is, hey, in this particular situation, guess what? Let's get the medicine. We need the medicine. Let's go. And so it isn't, again,
it's
beat on the drum and look at the sun and pray. It's like case by case, kid by kid. What's going on?
Let me ask you one other question.
To answer again, my answer to these people say you got to give all of them and you got to push them. I think that coercion like that makes people run. I think if you said to people, we'll sit and talk. What's the chance that my child's going to get meningitis if we don't do this so-called meningitis vaccine today? As close to 0 as anything could possibly be in medicine. Let me just say 0. That's not right. But I got to say 0 because I can't pretend that there's a reasonable chance that by not giving this meningitis vaccine at 2 months of age, during these 2 months your child's going to get meningitis. It's not 1 in a million. It's 1 in many, many, many millions, or it might be 0. What are the chances that if I coerce you into giving 6 vaccines today and you feel really bad about it, and your kid, that's 6 different doses of medicine, your child just doesn't act quite right that day. you might run. You might run. You might decide, let's wait another year or two, or maybe let's find a doctor who, instead, why don't we just talk about this? But boy, you're either pro-vaccine or anti-vaccine, and I'm so sick of it. I'm so sick of it but there's no talking to some of these people. There's no talking.
It'd be fun. The way you talk about it almost sounds like the Clinton-Trump thing. It has that much passion behind the way people polarize.
I'm talking
more
passion.
More.
This is your kid.
Right.
Your child,
Right.
unless your child's vaccinated, your child is not allowed to play with my child. That's
Right.
A lot of people are getting that.
Wow. Yeah, you're right.
My
You're saying you had a
doctor
friend.
told me. My doctor told me that I should not let.
And I think there has to be the third conversation,
Right.
which is this conversation.
Yes. And the conversation is, fine, support giving vaccines, support every vaccine. Disbelieve these terrible stories about the HPV vaccine as coincidence. By the way, they can't possibly all be coincidence. Disbelieve them. But at least talk to me. Stop yelling at me. Stop coercing this, and stop legally mandating. There in California, it's no shots, no school. That's it. There's a medical exemption. And you want to talk about severe criticism. There are people accusing doctors giving medical exemptions of selling them. Okay? No. There are valid medical reasons not to give vaccines or not to continue giving vaccines. That it's just like the accusation that doctors are giving vaccines for profit. I'm sure that there's a profit motive certainly at the manufacturing level. These guys are not making vaccines for their health, but I don't believe there are a lot of doctors giving vaccines to make money. They're giving vaccines because they really believe in them.
All right.
All right. Thank you, Dr. Gordon.
Oh my gosh, we could go on and on.
I know.